I would explain Pathfinder as a network of different organisations throughout West Sussex that are aiming to support people with their mental health. And some of these organisations primarily focus on mental health, i.e. one-to-one support, group activities to help with people's mental health. But on the other side of it, we also have people and organisations that are more focused on employment support and housing support and focused on the larger issues that may impact people's mental health.
15 years ago, I went through a period of hearing voices. I was living up in London and I ended up having a breakdown. I went through a period where I was taken into police custody. I was then taken from police custody to prison. I went from prison to the Maudsley Hospital, and I came out of the Maudsley Hospital and had to start my life over again.
We have people who may be seeing the crisis team, who may be in contact with the crisis team, who then say to them, well, actually, we're going to refer you now onto a Pathfinder clinician who works for the NHS. But these Pathfinder clinicians are also linked up with the Pathfinder service, so they can work with someone on their mental health. And after their work together, they can say, well, you know what? There is a service out here that can offer you care going forward and can offer you support and can offer you the chance to get involved in the community.
The benefits are this safety net between clinical discharge and community services. It enables people to extend their recovery time in a way that is comfortable and conducive to them.
I've been suffering from anxiety and depression for about 15 years. I was worrying about everything, so even like what clothes I was going to wear, and I just couldn't function. I was referred to Pathfinder by the NHS. Then I was telephoned by a peer mentor. Then I spoke to her fortnightly, and she gave me some strategies of how to cope with my anxiety.
Peer support workers have a superpower in the fact that we have lived experience. We're able to relate to clients.
Although our goal is for people to reach a point where they can manage their mental health independently, Pathfinder services are not time limited and we work at the individual's pace.
When I was referred to Pathfinder, I came down to the corner house. I sat down with Emma, who was one of the nurses, and she spent time listening to my story, listening to what I had to say, and she was there to basically support me with my next steps.
It really helped me to bond with my daughter, to bring her up, to know what clothes to put her in. I took her out to baby groups. I made lots of friends, and that's really changed my life. And now my daughter's 9 now, and we have a really great relationship.
There's a couple of projects that they had going, which was the running group, which I do on Fridays. We run along the coast, which is a lovely run and a great environment to run in. And I've basically been given a chance to meet up with a bunch of new people. We hang out and have coffees together afterwards. It's really helped with my socialising. And whereas before maybe I spent years and years kind of on my own in a lot of respects.
Pathfinder has also been described as a safety net for people who have serious or long-term mental health conditions, so that even if they are discharged from the NHS, there is support available for them, and they know that they can be stepped back up into clinical services in the future if they need it.
I think that the benefits of Pathfinder for service users is that it is simply ongoing support. We don't look at people and say, okay, you're recovered now, goodbye. We simply do just see it as a journey, and we understand that actually recovery isn't linear, and lots of people go through their lives having ups and downs. When you need us, we are here, and when you don't need us, we're proud.